Good evening, friends. Today I will come to you to discuss something about doctor-patient relationships, what doctor want from patients, what patient should not ask or tell to doctor. Welcome to my channel. It's Health and Pains. So let's start. Good evening, everyone. I myself, a physician by profession, and I have a YouTube channel also. Name is Hills and Plains. And today I want to discuss something about doctor-patient relationship in Indian setup. Everybody knows that doctor-patient relationship should be a good one, better one for his treatment and further course of treatment, his prognosis, and for all the further developments of relationships. Doctor আৰু পেচেণ্টৰ যিটো ৰিলেশ্যনশ্বিপ সেইটো সদায় ভাল হ'ব লাগে আৰু আমাৰ ভাৰতীয় সমাজত বহুতে ডক্টৰক ভগৱানৰ লগতো তুলনা কৰে যদিও ভগৱান নহয় তুলনা কৰে আমিও সৰুৰ পৰাই তুলনা কৰা দেখিছোঁ compare with God though it's not the God but it's try to heal the sufferings of human beings with their hands, with their machines, with their instrument, with their mind. Our doctor যেতিয়া এটা পেচেণ্ট চাই তেতিয়া অকল পেচেণ্টৰ হেৰিকে নাচাই it looks all around the patients including his disease, his mental status, his appearance, his behavior, all. যেতিয়া ডক্টৰৰ কোঠাত এজন ৰোগী সোমাই আহে সোমাই অহাৰ পৰাই এজন ৰোগীক ডক্টৰে বা চিকিৎসকে পৰ্যবেক্ষণ কৰে বা কৰিব লাগে Bimal Kumar, actually I don't know Bimal Kumar, there is there may be someone else. Hello sir, kaise hai? Acha hu main. How are you? And for say someone is coming to your doctor's chamber with limping, doctor may assume that he may have suffering with his legs or may he have some difficulties in walking, or if he come with a fearful mind or absent-minded, he may have some psychological problem, or if attendant take him his with trolley or wheelchair, then doctor may assume that something serious, critical with this patient. গতিকে এনেকৈ আৰম্ভণিৰ পৰাই আমি ডক্টৰৰ পৰাই পেচেণ্টক চাওঁ আৰু আমাৰ ভাৰতীয় সমাজত ডক্টৰ আৰু পেচেণ্টৰ ৰিলেশ্যনশ্বিপটো আগৰ পৰাই ভাল এতিয়াও ভাল যদিও মাজে মাজে দুই এটা বেয়া ঘটনা ঘটে কাৰণ কোনো ডক্টৰে পেচেণ্টৰ বেয়া হোৱাটো নিবিচাৰে. No doctor wants a patient to be go wrong, and he try to heal or cure his patient with all his knowledge, belief, experience, and healing touch. And when a patient comes, doctor may mandatorily ask his history, something related to his disease or ailments. So patient should cooperate with all this relevant data from his name, age, all this. আৰু ডক্টৰেও যিখিনি তথ্য ৰোগীয়ে কয় সেইখিনি খুব মনোযোগেৰে শুনে বা শুনিব লাগে, কাৰণ প্ৰতিটো কথাতে প্ৰতিটো বাক্যতে পেচেণ্টজনৰ কিছুমান কথা লুকাই থাকে বা আৰু ডক্টৰে সাধাৰণতে পেচেণ্টক প্ৰথম কিছুমান টেক কুৱেশ্যন সুধিব নালাগে বা সুধিলে পেচেণ্টজন বায়াছড হৈ যায়. সেইটো কাৰণে পেচেণ্টক প্ৰথমে নিজে নিজে কৈ যাব দিব লাগে, আৰু লাষ্টত যিবিলাক কথা স্কিপ কৰিলে বা নক'লে we can ask that type of question. আৰু ডক্টৰবিলাকে সাধাৰণতে পেচেণ্ট অহাৰ পাছত এনে এটা পৰিৱেশ ক্ৰিয়েট কৰিব লাগে বা ক্ৰিয়েট কৰা উচিত যাতে পেচেণ্টে ফিল ফ্ৰী to tell his sufferings. আৰু কিছুমান কথা ডক্টৰে ইণ্ডিয়ান ছেটআপত ৰিলেটিভৰ লগতো ডিছকাছ কৰিব লগা হয়. হয়তো ফৰেনত বা এব্ৰডত এনেকুৱা কথা হয়তো নাথাকিবও পাৰে ৰিলেটিভৰ লগত ডিছকাছ কৰা বা কিবা, কিন্তু আমাৰ ইণ্ডিয়ান ছেটআপত কেতিয়াবা ডক্টৰে ৰিলেটিভৰ লগতো কথা পাতিব লগা হয়. We have to discuss something about his sufferings with his relatives. If it is minor, definitely with parents. And as a doctor, we have to maintain some confidentiality. Confidentiality means under no circumstances we have to divulge anything beyond the consent of the patient to anybody except his guardian or near relatives. পেচেণ্টৰ কিছুমান কথা ডক্টৰে কেতিয়াও আমি আনক জনাব নালাগে আৰু নজনাও. যদিহে পেচেণ্টে কনচেণ্ট দিয়ে যে জনাওক বা তেতিয়া আমি জনাওঁ, আৰু জনালেও কিছুমান কথা নাম বা উপাধি এইবোৰ সলাই দিয়া হয় বা উজ্জ্বল ৰখা হয়. কিন্তু কেতিয়াবা দেখা যায় কিছুমান মানুহে কি হৈছে কিয় হৈছে এইবিলাক কথা খুব সুধি ডক্টৰক ব্যতিব্যস্ত কৰে. গতিকে আপোনালোকে কেতিয়াও আপোনাৰ যদি কোনো বিশেষ ৰিষ্টা নাই পেচেণ্টৰ লগত, তেতিয়াহ'লে পেচেণ্টজনৰ কি হৈছে কিয় হৈছে এই ধৰণৰ কথাবোৰ ডক্টৰক বা হস্পিটেলক নুসুধিব, কাৰণ ডক্টৰৰ এইটো কোৱাটো এজ পাৰ এথিক্স উচিত নহয়, এজ পাৰ হিপক্ৰেটিক অথ সেইটো উচিত নহয় টু divulge his personal sufferings or disease to anybody else except his conscience. আৰু গতিকে আপোনালোকে যেতিয়া ডক্টৰক তেনেকৈ সোধে বা হেৰি কৰে তেতিয়া এনেকুৱা কথা নুসুধিব. আৰু আমি ডক্টৰবোৰে সাধাৰণতে লেংগুৱেজ কেতিয়াবা এটা বাৰ হয় there's in the Indian setup there is lots of language we face. So for my example, I have worked in Mizoram, I have service in Arunachal, now in Nagaland. Lots of people, lots of language I have to communicate with these people. Say Mizoram, this we have to know something about Mizo dialect because to know patient suffering. And in Arunachal, everybody tell fluently Hindi. In Nagaland, we have to know this Nagamis, Hindi, English, and all. So language should not be a bar. When I was a student of Assam Medical College, I have one register. Now he is a professor, a senior professor, and it's head of department of medical college. He is a professor, Dr. Babulal Busumotari sir. I mention his name. He knows almost 10 or 12 languages. And very fluently he can talk to patient with English, Hindi, Nepali, Bengali, Nagamis, all language. So we cannot be master of any language because we have some limitation. So at least we have to communicate with patient so much easy way so that patient can feel free and tell his sufferings well to consider for doctor's diagnosis and decisions. So আৰু আমাৰ ইণ্ডিয়ান ছেটআপত আপোনালোকে চবে জানেই আমাৰ ইণ্ডিয়ান মানুহবোৰ এতিয়াও যেটো হেল্থ ইন্সুৰেন্স এই সম্পৰ্কে ইমান সজাগ নহয় জ্ঞাত নহয় বা হেল্থ ইন্সুৰেন্স খুব কমহে কৰে in our Indian people, especially these Assamese or northeastern people, they're not so much concerned about their health insurance and all. But everybody should do health insurance because if you do not have any health insurance, you have suffered some illness which costs 60,000-70,000. Some diseases, some needs operation. If you do not have any insurance, you do not get from any reimbursement from any and from your service, or that will be very difficult for treatment. And so always make a health insurance if you are not get from any help from your servicing organization, servicing department, say reimbursement type things. So health insurance is a must for all these peoples because it is very today's necessity because everybody sees that sometimes people feel very difficult to continue his treatment and ask for help in social media and all and knows that he or she do not have any health insurance. So be a concerned citizen, make health insurance with some small or medium premium range. There are lots of health insurance available nowadays. So keep it as a essential from your health side because nobody knows when you get sick, when you need operation, when you become diseased by illness. And some other things regarding health is financial, I have already told. And sometimes we doctor also asked about his religion also regarding his for treatment purpose. Say some patient have some birthmark or some, yeah, from that we can know whether he is a what religion from, because some disease is very prone to some other, but say from Muslim or Islams, they have circumcision, they hardly have this penile cancer, but Hindus and all do not do circumcision except, yeah, so is penile cancer is Hindus suffered sometime. And so for as a doctor, sometimes we face some very awkward situation, very fearful situation. When I was working in Oil India Hospital, Duliajan, in 90s, one evening I was in emergency. I was in doctor's room for some tea break. Then this attendant hurriedly telephoned me, "Sir, please come to emergency immediately. There is some cases from taken by some armies." So I hurriedly, without completing my tea, go to the emergency and see one patient, one young boy is grasping, or it is flooded with blood. And I have seen this his groin is lots of bullet injury, and he's already in the state of gasping. That is, he may be, after a few minutes he may die. So we do whatever necessary regarding all this information to senior doctors, because there is some rules what we have to do in such situation. So that is my first experience of this young boy, heavily bullet injury by army. I think on that time there is some army operation going on in Assam, especially in Upper Assam. So I have seen, and of course, but very sad that the patient dies after a few minutes at the casualty only. And there is another incident today I want to share with you. When I was in Sibsagar in a private hospital, Pragati Hospital, one day there is a bomb blast in SP office. One of my known journalist, he is succumbed to his injury, and his chest portion have a deep hollow of bomb blast and flooded with blood. That is my first experience seeing this bomb blast victim. He also died. Of course, he's not died at a casualty, he brought death to the casualty. So this type of very serious, critical scene we doctor people have to face in our lives, in emergencies, in normal day-to-day practice also. The common people may not see this type of, we doctor have to see, face and treat. So these are some relations, doctor, patient, and society. Now I want to tell something about your doctor patients. Nowadays everybody is busy with this internet and all, and there is a syndrome, I think you know or not, do not know, I don't know, that is idiot syndrome. That is full form is internet derived of stoppage of treatment. Because some people, after giving treatment to doctors, they stop by seeing on Google or some search media about the disease and stop their treatment, that this medicine have some side effect. গতিকে আপোনালোকে নিজাকে মেডিচিন বা ট্ৰিটমেণ্ট বন্ধ নকৰিব. You do not stop. Don't be so much eager with your Google search, because all things is not correct. They collect some data, some resource and give it to you. আৰু কেতিয়াবা এটা কথা দেখা যায় যে আজিকালি পেচেণ্ট সোমায়ে যে আজি মোৰ তাত এটা পেচেণ্ট এজন আহিছিলে আহি ইঞ্জুৰি কেছ, টিটি দিব লাগিব, এণ্টিবায়'টিক লাগিব আৰু ড্ৰেছিং, মানে কৈয়ে আছে. He is telling me, I am just examining his wound. Of course, any doctors know that any injury case will have some lacerated wound or this TT, antibiotic, dressing is essential, and he will prescribe. So don't tell or ask or request doctors this kind of questions. Because doctor know, let first doctor decide treatment, what he will give. Because do not interrupt doctor's decision by your end. It will sometimes doctor feel frustrated if you do this type of question. Of course, in Indian setup, there is lots of people do this type of question to doctor in clinic. So when you come to doctor's chamber, please do not ask this question, because doctor will say what is necessary for you. And somebody also tell that nowadays there is many patient come to our chamber or doctor's chamber and show his mobile, because mobile to দেখাই দিয়ে আৰু মোবাইলটোত দেখাই পেনে হয় ট্ৰিটমেণ্টৰ কিবা দেখাব, ইনভেষ্টিগেশ্যন দেখাব, এনেকৈ আপোনালোকে ডক্টৰক বা ডক্টৰৰ চেম্বাৰত যেতিয়া যায় এনেকৈ মোবাইলটো আগবঢ়াই নিদিব. প্ৰথম আপোনাৰ যিটো সমস্যা হৈছে, হোৱাট ইউ আৰ ছাফাৰিং ফ্ৰম, সেইটো কথা কওক, আৰু ডক্টৰে তাৰ পাছত কি ট্ৰিটমেণ্ট দিয়ে সেইটো আপোনালোকে হেৰি কৰক. মোবাইলত আপোনাৰ ৰিপৰ্ট দেখুওৱা প্ৰথম সাক্ষাততে এইবিলাক কথা মানে ডক্টৰ হয়তো আপোনাক খুলি নক'ব পাৰে, কিন্তু ভাল নাপায় বা কোৱা উচিত নহয়. আৰু কিছুমানে কয় যে মোৰ লগৰ এজনে এইটো বেমাৰৰ এইটো খাইছিলে, মই এইটো খাব পাৰিম নেকি? সেইটো কথাও আপোনালোকে নক'ব বা সোধাটো উচিত নহয়, কাৰণ প্ৰত্যেক পেচেণ্ট have unique features, unique symptoms, and unique adaptability to medicines. So do not judge yourself by seeing others' treatment. What medicine is sweet for you, that may not be fruitful for others. So সেইবিলাক কথাও ডক্টৰক নুসুধিব বা কোৱা উচিত নহয়. আৰু কিছুমান পেচেণ্ট আহে ডক্টৰৰ তাত এইবোৰ খুব ইমিডিয়েট মানে ভাল হ'ব লাগে immediate is not a rocket science everything even antibiotic is given for period of say course it will act and then you see results immediately you do not see any results in your medicine so don't ask also doctor regarding immediate फटाफट result होने वाला medicine दीजिए ऐसा because every medicine have take some times to act on human on patient and বহু কথাই ক'লো আপোনালোকক আজি আপোনালোকে কেনেকুৱা পাইছে নাজানো আজি বহুত দিনৰ মূৰত লাইভ আহিলো আৰু আপোনালোকে চেনেলটো চাই থাকে চেনেলটো চাই লাইক কৰিব যদি ভাল পায় আৰু বেয়া পালে ক'ব আৰু কেনে ধৰণৰ ভিডিও মই সাধাৰণতে ভিডিও এনেকুৱা ভিডিও কিছুমান দিবলৈ চেষ্টা কৰোঁ যাতে এইটো ভিডিওৰ পৰা সমাজৰ বা ৰাইজে কিবা এটা অকণমান পায় my content always try to give something some information from my videos may it be small may it be short but always try to give something to you for viewers আৰু কিতাপ apart from doctor and patient মই এটা কিতাপ এখন আজি অৰ্ডাৰ দিছিলোঁ কিতাপখন কিবা এখন আহিছে মই আপোনালোকৰ আগত আনবক্সিং কৰোঁ দেই এইটো কি আহিলে ভিতৰত আৰু এটা পেকেট আছে there is another packet on packet কি আছে বঢ়িয়া কি হয় বুক আৰু এই কিতাপখন চাওক কি কিতাপ আপোনালোকে নাম শুনিছেনে নাই ক'ব নোৱাৰো মই শুনি আছিলোঁ এখন বহুত ভাল কিতাপ হয় বহুত বেষ্ট সেলাৰ কিতাপ this is rich dad poor dad এই কিতাপখন আনিছোঁ পঢ়িব লাগিব it's a very good book best seller book having some financial ideas thoughts in this book which is very essential for you as per book review with this book given another book that is the psychology of money I do not know many of this book but with this poor dad rich dad poor dad এখনৰ লগত এখন ফ্ৰী দিছে গতিকে কিতাপখন পঢ়িব লাগিব আপোনালোকে কোনোবাই পঢ়িছে নেকি if anyone read this rich dad poor dad please comment on comment box and বহুত ভাল কিতাপ এখন is a very good book as per review rich dad poor dad বহুত ভাল written by Robert T. Kiyosaki Robert T. Kiyosaki I think he is Japanese so friends আজিলৈ ইমানেই বহুত দেৰি কথা ক'লো আপোনালোকৰ লগত 29 minutes হ'ল আৰু বাকি আপোনালোকে মোৰ চেনেলটো চাই নে নাচাই কমেণ্ট কৰি জনাব Chris Agoral Monisha hi Chris Agoral Monisha Chris Agoral Kaju bhai हेलो सर, कैसे है आप? कहाँ से है? कहाँ का लिया आपने ये नहीं? Any most you know Bimal Kumar? ক্ৰিছ আগৰৱালা তোমাক চিনি পায় নেকি? বাৰে বাৰে সুধি আছে। মনীষা হাই কৈ চিনি পায় নেকি? অঁ তো bye bye friends, that's for today. So that's for today. I conclude this live stream, half an hour live stream. Please view if someone is not on live stream and comment me. আৰু good night everyone. See you tomorrow. Thank you.